Yeah, and my name is Pablo Knobel. I'm Ph.D. in environmental epidemiology. And today I'm going to talk a little bit about why greening for health. And I know this part you already know a little bit why it's good, the greenness is good for health. And I also want to talk a little bit about how greening for health. But I don't want to talk about exactly the how. I just want to talk about why we need to talk about the how, why it's important how we green. And I will get to that, but just a teaser. Uh, introducing, whoop, Introducing myself a little bit further. I'm graduated in environmental sciences. I'm master in ecological economics and political ecology, and I'm PhD in environmental epidemiology. I'm a little bit of a rara avis in environmental epidemiology because people normally are doctors or biostatisticians, and I'm a little bit of a different person. That's what I think I have a slightly different perspective on this relationship between urban green and environment and human health. And a short outline of what we're talking about. The first 2 points are about why should we green in cities for health, and the third and fourth are about why we need to think about the how we do it. And getting right into it, urban green and human health. And there's a lot of literature about this. People have been studying this for many years. The last Robert just presented, I think it's the first study with by Ulrich, the one that's the people looking at windows from after an operation and so what happens. That's the first one, I think in '84, and then they started doing a lot of research. And in the last year, that got even further. I have some complex looking figures, but I walk you through them with very easily, showing the main idea of each one of them. And the first one here is that there are a lot of health outcomes that have been related to human health, to urban greenness. A lot of them. Here's just a summary of some, but there have been a lot. I think the only thing that we have not been able to relate to human health in between greenness and human health is some infectious disease that don't go through animals. That's the only thing that people don't see a lot of sense of relating to between greenness and health. You can see that they go through everything from mental health to cardiometabolic diseases to mortality. Everything has been related between human health and greenness. The other important idea that I think it's very relevant is that the health benefits go from before we are born, when our mothers are exposed to greenness during the pregnancy. That seems to be very relevant for our health throughout our life. And then childhood and adolescence when we are adults, and of course when we are setting population with other things related to healthy aging and such. So a lot of health benefits that go throughout life. However, there are some studies that are consistent. We get some results that say something and others results the same another thing. And this might be because the relationship is very, very, very complex. There are a lot of things intervening, and the ways that greenness affect health, it's rather complex. It's not something we can measure easily. There's different ways of looking at this relationship, at this underlying mechanism between health and green space. One way of doing it could be like this Neuerhausen does, that they look at what greenness has that benefits people. And this could be things like in the mental restoration, the chemistry of the green spaces, the increasing of physical activity, so on, so on, so on. And then we can look at another way like Markiewicz does, that she looks more from a nature-based solution perspective, looking at what greenness offers to people. And as you can start to imagine, these things relate in different ways. For example, the mitigation is related to the mitigation of environmental hazards. The restoration is when greenness offers something new. Allow us to get something that we had and we get it back, for example, the mental restoration. And the installation is when greenness brings something new to the game, for example, the possibility to do physical activity. And then we have a last thing that we can look at this relationship from how people interact with greenness. And it's not the same as if we just need the greenness to be close, like the proximity to green. I have a tree next to my house, but I don't see it, I don't interact. It doesn't matter. I just have it nearby. And this could be very relevant for environmental hazards, for example, pollution. I don't have to interact with it. But then it's the view of green that I don't have to directly interact with it, but I see it through my window. Maybe it's a private park, but I can see it. And then is the interaction. So there's a lot of health benefit of greenness, but this relationship is very, very complex to measure and to really pinpoint what's going on. And you can say, well, until now you haven't general overview. Well, let's get into some specific details about why it's important for cities. Some very specific studies. I just want to go through them like in the quickest way possible, just by seeing the title and bringing some ideas that let's call it some food for thoughts. And I think greenness, especially the benefits of greenness, are especially interesting for urban health because they tackle some things that are very important for urban dwellers. Environmental exposure that are increased when you live in cities, physical activity, or we can look at from the sanitarism part, stress related to urban, the human context, and social cohesion, something that we sometimes forget about, but I really like to talk about because it's very linked to human life, and we see how it's different from rural areas to urban areas. Getting into environmental exposures, really, it's very a quick overview to just throw some ideas into something that you maybe know already about. When we talk about environmental exposure, is that things that we normally think about pollution and that kind of things, but we sometimes forget about noise. And noise is something that's, for greenness, is very interesting because it goes in two ways. First, it can reduce the amount of noise pollution. We have a green barrier, so the noise cannot get through. But also, there are studies that show that we go from noise pollution to nice sound. It's called what they call the soundscape. Greenness has the possibility to offer us sounds and some sensory inputs that are beneficial for health. For example, hearing birds singing. That's something that we can imagine it's good for health, it's good for us, but slowly we're getting evidence about it. And of course, we have pollution, classical pollution in the PM2.5 sense, that there's a lot of literature about it, that how that relationship works and how they interact. Then we have the physical activity and obesity. And I bring these two articles for two main ideas. The first one is that greenness has been associated with physical activity. But not only that, doing physical activity in green spaces, there's evidence that shows that it's even better for health. Not just the motivation of doing physical activity, but they also doing physical activity there. The second idea I want to throw in is that, as I was saying before, it's throughout life. Children and older adults, as I was saying before, all the life course. Then we get into stress. And I bring these two because I have some interesting ideas I really like. The first one talks about physiological stress, and they also talk about multisensory virtual experiment. With physiological stress, I really like calling it like this because we can think about stress in something that's measurable through biological measurings. We get samples from cortisol, for example, and we have a measure of stress that it's not self-reported. Well, I feel stressed. No, it's something else. And I really like the idea of the virtual experiment. This means that this study was not done in actual green spaces. They were not physically there. They were simulating a green space through images, sounds, videos, maybe virtual reality stuff. We don't necessarily, it seems that we don't necessarily have to be there. We can just, with the exposure through images, it also seems to have a beneficial effect on health. The second idea is to talk about stress recovery. And as Robert was saying just before, it seems that, well, we know that we have the development of human habit most of the time in nature and not in cities. And it seems that somehow our brain remembers about that. And being exposure to greenness, some author says it allows us to recharge our mental batteries. And it's something very complex to explain. I am not able to explain it in a technical way, but that sentence works very well. We're in greenness and we're in nature and our brain recharges. It's like, it's the kind of inputs it's used to it and it's built into, so it allows to get it back, get the energy back. And finally, the social cohesion, as I said before, something I think it's very interesting because it's something that we sometimes forget about, but it's something that isolation is a real problem in cities. Although we live with more people nearby, many times we feel more lonely. And one very good example for this is urban green or urban agriculture, where people meet, they find this place, they also grow a sense of ownership on the spaces, and then people meet their neighbors, and also they have intergenerational communication with grandpas, with grandsons, so on. So that's why we should green for human health. There's a lot of evidence, a lot of literature. We could talk about this for 3 hours and keep bringing information in. But I also want to talk a little bit about how. And as I've said before, not just about how, not giving actual instruction for how, just saying why the how is important. And I'll bring in 2 studies. The first one is from the city of Barcelona. And the first idea I want to present is the urban green quality. What is urban green quality and why it's important? Well, quality can be understood as the attributes that affect the use and interaction of the population with urban green, including characteristics, features, and fitness of purpose. The interaction of the population. This is a key idea. And it makes a lot of sense that the quality of urban green is relevant for health. Why? Well, we can look at these 2 spaces and say, well, this first one might be great for physical activity because the linearity allows people to run. Well, this one, well, for physical activity, maybe not so much, but it's more cloistered and we can relax better. And this one might be great for noise reduction because it's like a barrier from the buildings. And this one way, maybe not so much, but it might be great for bird biodiversity. So it makes sense that different green spaces have different effects on human health. And then we got into see some results. I know this plot, it's necessarily complicated, but I want to run you through it. It's a study we published, I think, a couple of years ago. Oh, no, it's published this year, sorry. Basically, the idea is that the big yellow dots are the ones that are, as we call it, significative. And we're seeing the relationship between different quality dimensions, the absence of incivilities, the access, the aesthetics, the amenities, the animal biodiversity, bird biodiversity, facilities, potential use, safety, and surroundings with 3 different health outcomes: overweight, obesity, physical activity, and use. And there are 2 very interesting things to see here. The first one is that the relationship are heterogeneous. Some health outcomes, some quality dimensions are linked with some health outcomes, and some are not. For example, the absence of incivility seems to be linked to overweight, obesity, and physical activity, but not to use. And access seems to be linked to use, but not to physical activity and not to overweight. And this is already very interesting. It has very interesting insights with it because we know that if we want to have some specific health benefits, we need to tailor our greenness to it. We need to think about what do we have and where do we want to accomplish. So we need to think about how we are doing it. The other interesting thing we found is that the only quality dimension that was significant for everything was bird biodiversity. And that was a beautiful finding for us because looking at quality dimension assessment tools, this is always overlooked. It's something that it's immensely difficult to measure. And we managed to measure and we managed to see it was very relevant. If you later want to talk about why we think that bird biodiversity is relevant for health, we can talk about it without problem. And until now, we're looking at the quality of green spaces, but we can also think about the people. We say it's the interaction with the greenness with the people. So do different people interact with greenness in different ways? We think so. And the idea behind it is the social determinant of health. I don't want to get too deep into it, but it's basically the condition in which people are born, grown, work, live, and age, and the wider set of forces and systems shaping the condition of daily life. So basically how people's lives affect their health, not just well, how they are and how they live, and how the context, the social demographic, social economical conditions. And here's the results for just for obesity, for the effects of quality. And we are separating the effects for males and females, adults and senior population, and then different levels of education. And if it's more to the left, sorry, it's more protective. And we see there are some interesting differences. From these plots, we see, well, it seems that quality is more protective against obesity for females than males. It's not a crazy statistical difference. If a statistician look at this, well, it's there, but it's not too powerful, but it's there. We see some very, 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 very interesting patterns. And same goes with educational level. We see that people with a higher educational level are more protected than people with a lower educational level. So these are already also super interesting, because we said that we need to think about how we design green spaces for what we want to accomplish, but also we need to keep in mind how are the people that live there, how are their characteristics. It's older, younger, higher educational level, lower educational level, and also not only the people that we live there, also the people that we want to target our greenness measures to. And you might say, well, this is an example in Barcelona, maybe this only happens there. Well, I quickly show you a different example with some very different measures in the city of Philadelphia. And what we did here is we compared 4 different greenness measures with obesity. And we'll look at one measure of perceived greenness. So we asked people about how they perceive their greenness in the neighborhood. And we have 3 measures of objective greenness: proportion tree cover, proportion vegetation cover, and NDVI. NDVI, just very quickly, it's let's say a complex index that measures greenness reflectivity. And it's commonly used as the golden standard for greenness measures in cities. And we need to look at this part here, and we see that, again, going the lower, the more protective. And we see that perceived access is very protective. We see that proportion tree cover is quite protective, and the other ones, not so much. And these are, it's again, super interesting, because this is saying, we don't care, people don't care if they have actual greenness nearby, have objective measures of greenness. They just care if they can see it, if they can access it, if they perceive it as it's there. And also we see that while it's there, it doesn't really matter in this case for the city of Philadelphia and obesity. It doesn't really matter if we have shrubs or grasses. What people seem to care, or health people seem to care about, is tree cover. But again, we can also, and this is super interesting, but I'm going to say, well, we can look at these again from the people perspective. And this is exactly what we did. We stratify our results by poverty. So we are looking just at different levels of poverty. And we see very, very interesting patterns. We see that the perceived measure have one pattern and the objective measures go the other way around. What does this mean? This means that for the perceived access measure, when we ask people about how they perceive greenness, in rich neighborhoods, it's not so useful. We before saw it super useful, now not so protective. In poor neighborhoods, super protective. And objective measures go the other way around. Rich neighborhoods, very protective. Poor neighborhoods, objective measures, not so much. And this is super interesting. It seems that if you're rich or you live in a rich neighborhood and poor neighborhood, you need to think about how you're going to green in a different way. I have an extra plot about race, but I think I don't have to explain it. So if you want to talk about it later, you can ask about it. And just want to go right into the conclusions and some summary ideas of what we just talked about. A summary of the results, we can just say that urban green seems to be good for human health. However, the relationship, the associations are complex. And the second thing is the association are dependent on the characteristics of both urban green and humans. If we want some food for thought, some things about that we need to take home and think about, I would say that urban green by itself is not necessarily good. It's not, yeah, we say green is here green is good. Not necessarily. Even green can and needs to be tailored to maximize health benefit. We need to think about, as I say in the last thing, we need to think about the how. We need to think about who are we aiming our greenness to and to what health benefits. And that's all. Thank you very much. I'm happy to be here. I hope you liked it. You can find me on my email or at Twitter or wherever you want to contact me.